Hello, my name is Dr. Ange. I will be teaching you today how you can save a life. I'm going to be speaking about how to recognize an opioid overdose and how to respond to an opioid overdose. Opioids are a type of depressant drug. They slow down the body, including breathing, and can make people sleepy. Opioids can reduce pain, manage opioid dependence, or make someone feel happy or relaxed. They can be taken by mouth, injected, placed on the skin, snorted, or smoked. Opioids can be prescribed or used illegally. Common opioids include heroin, fentanyl, morphine, methadone, codeine, and oxycodone. An overdose happens when the body is exposed to a toxic amount of one or more substances. The body becomes unable to control processes required for life, like breathing, heart rate, and body temperature. Not everyone who overdoses will die. However, if overdose is not treated quickly, lack of oxygen can cause brain damage. Anyone can overdose, regardless of substance use history. So how do you know if someone's overdosing? The person may have slow, shallow, or irregular breathing, which can sound like a deep snoring or gurgling. He may be breathing very slowly or not at all. He won't respond to stimulation. His lips or fingertips may look bluish if he has lighter skin. If he has darker skin, he may look purplish. He may look pale. He may be choking or vomiting. The two most important signs to look for are slow, labored, or no breathing, and lack of response to stimulation. Now I will walk you through how to safely check for response stimulation. Tim is going to help me demonstrate. If he isn't breathing or his breath is shallow or slow, he may be having an overdose. Check for response. Shout his name. Give him a firm shake. Tim! If he doesn't respond, move around to the sternum. Use your knuckles and rub firmly on his breast belt. This will be painful enough to wake him up if he's passed out or asleep, but it won't cause him bodily harm. Remember, don't try to stimulate him by kicking him or holding a lighter to his skin or putting him in a shower or an ice bath. These methods could cause serious injury if he's unresponsive. Overdose is a medical emergency. Without professional medical help, an overdose can lead to coma and death. Once you've recognized an overdose, call 911 immediately. It may be the difference between life and death. Give air through rescue breathing and give naloxone if you have it. If you have to leave the person at all, for even the time it takes to call 911, make sure you put him in the recovery position. This will help to keep the airway clear and keep him from choking on his vomit. To get the person in the recovery position, lay him on his side, supporting his body with a bent knee. Turn his face to the side and rest his head on his arm. When someone overdoses, the biggest danger is lack of oxygen. Rescue breathing can give the overdose victim the oxygen they need until help arrives. First, place him on his back, put your hand under his neck, and tilt his chin up to look into his mouth to see if there's anything blocking the airway, like gum. If there is, remove it. Gently lift his chin to open the airway. Pinch his nose closed and place your mouth over his, and give 2 breaths into his mouth. After each breath, turn your head and look to make sure that his chest is rising and falling. If you don't see the chest rising and falling, then tilt their head back more and try again. Once these 2 breaths get going, give 1 breath every 5 seconds. Continue this rescue breathing pattern until the person starts to breathe on his own. If you have naloxone available, you'll have to stop rescue breathing to assemble the kit. This is okay. Naloxone is a safe, legal medication that can reverse an opioid overdose. Naloxone reverses an opioid overdose by temporarily knocking the opioids off the receptors in the brain. This allows the person to breathe again and regain consciousness. Narcan is free, legal, and easy to use. You can give naloxone by injection into a large muscle or intranasal, sprayed into the nose. Today I will demonstrate how to administer naloxone as a nasal spray. One common brand of intranasal naloxone is called Narcan. The first step to administering naloxone is to remove the nasal spray from the box. Peel back the tab with the circle to open the nasal spray. Hold the nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Gently insert the tip of the nozzle into either nostril. Tilt the person's head back and provide support under their neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the bottom of the person's nose. Press the plunger firmly to give the dose of naloxone nasal spray. Remove the naloxone from the nostril after giving the dose. After giving the naloxone, move the person on their side to the recovery position. If the person does not respond by waking up, to voice or touch, or by breathing normally, another dose may be given. Naloxone nasal spray may be dosed every 2 to 3 minutes if you have more available. With a few simple steps, you can save a life.